Hi, I am Dr. Abdul Hakeem from Relief Medical Center, Ajman. As a general practitioner, I see people with a variety of health issues. I am sure that most of the people would consult a doctor for the complaints of fever and flu. Today I am here in front of you to clarify between what is fever and what is flu. Fever is the body's immunity's reaction to any of the offending agents. These agents can be a virus, bacteria, or any allergic reactions also, and many other pathogens. This is like when an army defends and the reaction occurs like fire and smoke. This is the fever. But flu is only one of the reasons for fever. Flu is the respiratory virus which affects even young persons to very elderly patients, and it occurs in every winter seasons. The symptoms of flu ranging from simple fever, cold, cough, breathing difficulty, throat pain, body pain, weakness, fatigue, and even redness of the eyes. It even ranges to severe respiratory distress and much more complications. And the time interval between when a patient is exposed to another patient with this flu is approximately 2 days. The characters of influenza also overlap with those of other viral infections, so it's extremely difficult to differentiate between the infections of other viruses unless we do a laboratory test. So there are three types of influenza viruses: A, B, and sometimes rarely C also. The majority typings of influenza occurs through identification of 17H and 9N antigens, together contributing to the different combinations of 144 potential subtypes. So the H3N2 and H1N1 are the most common infection subtypes occurs in the human beings. The A is more problematic than the B, and the C virus occasionally infects young children. Now it's about testing for influenza virus. Why should we do an influenza test? Because clinically it's very difficult to differentiate between the different kinds of viral infection. And also we have promising treatments for the influenza virus infections. Ideal, the test should be an isolation of the virus from the nasopharynx or throat, but it's time consuming. Like COVID-19 or corona, we also have an RT-PCR test available for the influenza. There are some rapid tests available which is not much reliable. These tests also should be complemented with blood counts, chest x-rays, and also monitoring with the pulse oximeter, that is saturation monitoring. So how do we manage if you have a flu? Apart from the standard treatment modalities like plenty of oral fluids, bed rest, appropriate diet, and consult your doctor to start antiviral drugs better before 48 hours so that the outcome is better. We all know that the prevention is better than cure. So prevention, again, we have the standard public health modalities like social distancing, hand sanitizers, and a standard mask and personal protection equipment, taking leave and isolation from the infections patients, and this prevents the spread of the infections. And also we have the great modality like immunization or vaccination with the influenza strains. The influenza vaccine provides reasonable protection against the immunized strains. An inactivated influenza vaccine in different formulations is available for age groups above 6 months to 65 years. And anyone who are ready to take the influenza vaccine should remember one thing. Even if you don't have any allergy for the vaccine, it's always better to take the vaccine in a center where you can identify the allergic reactions and manage appropriately. I've seen many people taking vaccine just at home or any other centers. So make sure that you do it in a safe area. The other important thing is that each year the vaccine is combination of different strains. So it's always make sure when you take a vaccine, that vaccine is mentioned for that particular period, like that 2022 to 2023, 2021 to 22, like that different batches are available. So please make sure before you take, that is the appropriate strain is included. The vaccine can be taken even during pregnancy and also in the elderly people. The vaccine, if taken during pregnancy, the protection, that means the immunity lasts in the baby up to 6 months of life. So please make sure you all take your influenza shots before the start of the winter seasons, and hope you all follow our social media platforms, and any comments please post below. Thank you very much. See you there.